Muy buenos días.
My name is Paula Cáceres. I am the head of the OIE World Animal Health Information and Analysis Department. I am very pleased to present, as every year, the report on the animal health situation worldwide that the OIE produces to keep member countries informed. This presentation is divided into 5 parts. We will be focusing on the main findings and conclusions. For more details, I suggest you read the full report, which is posted on the OIE website. In the first section, I will present an analysis of reporting indicators from member countries. As you know, according to Chapter 1.1 of both OIE health codes, an immediate notification must be sent to the OIE within 24 hours of confirmation of an event. However, this is not always the case. To improve notification, the OIE has implemented different strategies. Active search activities and verification of non-official information have been in place since 2002. We have advanced software to conduct these activities. Since 2016, during the verification process for semi-annual reports, we used an indicator to quantify the diseases reported in semi-annual reports, but for which no immediate notification had been sent. The results appear later on in this presentation. The gray line shows spontaneously declared immediate notifications between 2016 and 2019. The red line shows the total number of immediate notifications declared after our department contacted the country consequent to active search activities. The shaded blue area corresponds to the effects of active search activities for that same period. During this period, 128 immediate notifications were reported in this way. The orange line shows the estimated maximum number of immediate notifications that we should have received through WAHIS. For this period, our department identified 178 diseases that were reported in semi-annual reports, but for which there were no immediate notifications. This means that this yellow shaded area corresponds to the events that were not reported through immediate notifications. We can see that the proportion of immediate notifications that were not submitted has decreased during the period. These results show an improvement in the transparency of notifications, no doubt due to the positive effects of active search activities. Notwithstanding, the number of events not reported through immediate notifications but picked up in semi-annual reports could be lowered even more. Detecting events and notifying members in a timely manner are constant quests for the OIE. In the second part of my presentation, I will be showing you the world situation with regard to 4 OIE listed diseases for which episodic situations are observed. The first disease is African swine fever virus infection, which is considered endemic in Africa. But since 2005, several countries have reported the first occurrence. This is the case with Mauritius 2007, Central African Republic and Chad in 2010, and Mali in 2016. As you can see in this video, the red dots show the outbreaks reported from 2005 to 2020. In 2007, major change came about when the disease reached Europe and spread to more than 17 countries. In August 2018, the first occurrence was seen in Asia, in the People's Republic of China, from where in 2019 it spread to Mongolia, Vietnam, Cambodia, Hong Kong, People's Republic of Korea, Laos, Philippines, Myanmar, Indonesia, and Timor-Leste. In 2020, it was reported in Papua New Guinea and on May 21st in India. Without a doubt, we are facing a rise in the ASF epidemic throughout the world. Of the 43 countries and territories affected by ASF in 2019 and early 2020, 28 countries sent immediate notifications. This table shows the difference in percentages of reported outbreaks in wild boar and in domestic pigs by region. It allows us to see the diversity of regional dynamics and surveillance strategies for both wild and domestic species. In 2019, ASF was the disease most reported through immediate notifications and for which considerable coordinated efforts are being made for its prevention and control. In 2014, and under the auspices of GFTADS, a standing expert group on ASF in Europe was established. In 2019, similar initiatives adapted to each regional context were launched in Asia and in the Americas. Since 2017, a regional strategy for ASF monitoring in Africa has been in place. During the 87th OIE General Session in May 2019, Resolution number 33 was adopted, listing 15 recommendations for disease control. Veterinary services and the OIE have also developed communications and awareness campaigns to prevent and control the disease. The OIE has communication tools available in several languages. It is important to remember that our department produces regular reports on the global situation of ASF and that regularly the OIE websites post weekly updates on the situation in Asia. The second disease we're going to be looking at is highly pathogenic avian influenza virus infection. This graph shows us the chronology of outbreaks reported in OIE immediate notifications from January 2019 to April 2020. The blue line shows 618 reported outbreaks in poultry for that period, and the brown line shows 52 outbreaks in wild birds. As we can see, the trend points to increased disease activity in the first months of 2020. This map shows the geographical distribution of the outbreaks. In red, we have outbreaks in poultry in 26 countries, the vast majority of which were reported in Europe and Asia. To contain the outbreaks in poultry, veterinary authorities have responded by applying stamping out measures, increasing surveillance, and giving recommendations to poultry farmers to increase biosecurity. During the same period, in green, 52 outbreaks in wild birds were reported in 13 countries, and the most frequently reported serotype was H5N8. 4 countries reported a new strain in 2019. In March, Egypt reported subtype H5N2. In April, Cambodia reported subtype N5N2. In September, Chinese Taipei reported subtype H5N5. In December in 2019, Nigeria reported the first occurrence of subtype H5N6. In February 2019, Namibia reported the first occurrence of subtype H5N8 in wild birds. Just as we do for ASF, our department also updates the information on the avian influenza situation that is posted on the OIE website monthly. OIE standards, together with transparency in reporting through WAHIS, provide the framework for veterinary services to effectively implement surveillance, reporting, and control measures for avian influenza. The third disease we're going to be looking at is COI herpes virus infection, which had one of the highest numbers of immediate notifications for aquatic diseases submitted to the OIE for 2019 and the beginning of 2020. This infection can affect various species of carp, which are highly valued economically. According to the FAO, in 2017, 53% of annual world tonnage of fish from aquaculture corresponds to cyprinids. During this period, approximately 100 countries provided information on the infection, of which 22 reported the presence of the disease in their semi-annual reports. 3 countries reported the first occurrence of the disease through immediate notifications. They were Iraq, Norway, and Slovakia. 3 other countries reported the recurrence of the disease: Ireland, Romania, and South Africa. The fourth disease, also in aquatic species, is infectious hematopoietic and hypodermic necrosis virus. The disease has a worldwide presence in wild and farmed Penaeid shrimp. During this period, approximately 100 countries provided information on the disease, of which 14 reported the disease in their semi-annual reports. During this period, 3 countries reported the infection in immediate notifications. The United States of America reported 2 disease events in March 2019, with 2 recurrences of the infection in farmed shrimp in California and New Mexico. And in May 2019, first occurrences of the virus were reported in Texas and Florida. In June 2019, Canada reported their first occurrence of the virus in farmed shrimp. It was established that the origin of the infection was imported shrimp post-larva. In July 2019, the United Kingdom reported the first occurrence of infection on 2 shrimp farms. The origin of the infection was also imported live animals. It is significant to point this out because within the span of 2 months, 2 countries located in 2 different regions reported the infection subsequent to legal importations of shrimp larvae. To conclude this part of my presentation, we would like to remind member countries that both OIE codes provide comprehensive guidance on the importation and transit of animal products and on disease control and prevention. OIE standards and transparency in reporting through WAHIS help provide a framework that member countries can use to implement effective disease surveillance and control measures. In the third part of my presentation, I will describe the global situation for 2 OIE-listed diseases for which global control or eradication strategies have been implemented. The first of these diseases is foot and mouth disease. On this map, you see the distribution of FMD through to 8 January 2020. 156 countries provided information through their semi-annual reports. 51 countries reported disease as present. As shown on the map, there is considerable stereotype diversity in Africa compared to the Middle East, which reported essentially stereotypes A and O for this period. During this period, 14 countries reported FMD through immediate notifications. Comoros reported the first occurrence in one zone. Pakistan and Uganda reported two new strains, serotype O and A, respectively. All other countries submitted notifications for the occurrence of the disease. The OIE FAO Global Strategy for Foot and Mouth Disease Control was adopted in 2012. It is used to assess the epidemiological situation and the evolution of the disease. We use three indicators. The first is the quality of the information received through the semi-annual reports. The situation in 2012 was taken as the baseline for comparison with the 2018-2019 period, working from available semi-annual reports. An indicator was calculated for 201 countries. In the table, you'll see the results. 6% of the countries improved their reporting on FMD. This meant they went from not providing any information at all to information present or absent. 2% of the countries, that is to say 4 countries, also improved information on circulating serotypes. They went from no detection to reporting circulating serotypes to the OIE. However, 3% of the countries provided information of less quality on serotypes, and 2% also reduced the quality of the information in their semi-annual reports. The second indicator used for assessment was change in official FDM status. On this graph, you can see that 64 countries were able to maintain their official OIE health status, so free of the disease, and an additional 3 countries were officially recognized as being free of FMD. The number of countries officially recognized as having disease-free zones without vaccination increased from 10 to 11, and those with vaccination increased from 4 to 8. We can thus conclude that since 2012, there has been an improvement in the quality of the information provided and in the number of new countries or new zones recognized as officially free of the disease. The number of countries that reported the presence of the disease remained mostly unchanged at 50 to 61. The number of outbreaks recorded during the period, as you can see on the graph, varied a lot, from 1,500 to more than 3,500 outbreaks per half year, although no clear trend emerged during the period. The OIE recommends that member countries continue their efforts using as a basis the global FMD control strategy. The second disease is PPR virus infection, for which the OIE and the FAO developed the global strategy for the control and eradication of La Peste de Petit Ruminant within the framework of GFTADS approved in 2015. On this map, we see the distribution of PPR with data from 150 countries. 37 of the countries reported the disease as present. The countries affected by PPR are mainly in Africa, the Middle East, and Asia. Currently, there is an outbreak outside of the traditionally affected regions, which is ongoing in Bulgaria. 3 countries, Israel, Libya, and Morocco, reported the recurrence of PPR through immediate notifications during this period. Just like for FMD, we use the quality of information contained in semi-annual reports as an indicator to assess 200 countries. Overall, the reporting of PPR improved during the period. 11 countries provided better data to the OIE. The second indicator is change in official status with respect to PPR. During this period, 51 countries maintained their official OIE health status, and 6 additional countries were officially recognized as free of PPR. 2 countries, however, had their disease-free status withdrawn. We are able to conclude that since 2015, the quality of the information contained in semi-annual reports and the number of countries officially recognized as free of PPR have improved. Also, the number of countries affected by the disease ranged from 45 to 51. The number of outbreaks recorded during the period ranged from 1,000 to 1,800, with a clear trend towards a decrease in the number of PPR outbreaks reported during the period. We can therefore conclude that there is a trend towards improvement of the global disease situation. This indicates that countries have increased their efforts to implement prevention and control measures. It is important to pursue these efforts if we are to achieve global eradication of the disease by 2030. Because this report was prepared at the beginning of the current year, in our fourth part of our presentation, we would like to update you on 2 events that have occurred since then. At the beginning of the COVID-19 crisis, the OIE created several ad hoc technical working groups to provide scientific advice on research priorities and on the consequences of COVID-19 on animal health and veterinary public health. This information was compiled and posted on the OIE website and is available in the section Questions and Answers on COVID-2019. With respect to notifications for disease in animals, 7 countries have reported such cases of the disease, as you can see on the map. To date, the disease has been transmitted mainly from contaminated humans to animals. Guidelines have been drafted for sampling, testing, reporting through WAHES for this emerging disease. Our team works every day to identify new events through the Active Information Search System using platforms such as EIOS and IBIS in strong coordination with the WHO and the FAO through GLUES. The second disease that was chosen is the first occurrence of African horse sickness in Asia, reported in Thailand at the close of February 2020. This is the first time that serotype 1 occurs outside of Africa. Vaccination started in April with a polyvalent live attenuated vaccine. As of 21 May 2020, 10 provinces have been affected with almost 600 cases, and the event is ongoing. The fifth and last part of this presentation is a progress report on the new OIE WAHES platform. The new OIE WAHES has been designed by taking into account the comments of its users, of member countries, and of focal points. It supports the principles of the future OIE 7 strategic plan regarding digital strategy. It features things such as easy data entry and interoperability capabilities for data exchange between OIE WAHES and other applications. We are working with the European Commission to achieve interoperability with the ADIS platform as of 2021.
del año 2021.
OAE WAHIS will incorporate validated data dating from 2005 to date. The homepage will provide an overview of recent health events and will also have data filter and extraction functionalities, improved mapping capabilities, and dedicated control panels for health information analysis. In 2019, work was undertaken on testing, data migration, and the development of the platform. Since October, key user meetings have been organized via teleconferences and throughout the world to keep key users informed of the project's progress. In 2020, existing online training modules were redesigned and in-person training courses were organized in the Americas, Africa, the Middle East, and Europe. Training in Asia was postponed due to the COVID-19 crisis. In the last several months, we have continuously communicated with member countries to keep them informed on the project's advancements. OAE WAHIS will be delivered in 2 phases. Phase 1 will support immediate notifications and follow-up reports and semi-annual reports. Will have a public interface with adapted control panels and the new alert application for smartphones. Phase 1 delivery is planned for the second half of 2020. Phase 2 will support the annual report and the voluntary report on wildlife diseases not listed by the OIE. Expected availability of Phase 2 is for 2021. Finally, I would like to thank my team at the Global Animal Health Information and Analysis Department and the OAE WAHIS project team for their excellent dedication and professionalism, which will allow us to launch the new OAE WAHIS in the shortest time possible. Do remember that both teams are always available to provide you with support and that all your comments are crucial to ensuring the future advancement of the OAE WAHIS platform. Thank you very much for your attention.